Hi, good evening. Hello, everyone. It's a pleasure to be with you all this Friday evening at 5 p.m. And thank you so much for taking out the time to spend with us to know more about brain health. I'll spend about 30 to 40 seconds on our introduction, and we'll very shortly kick into the session. Can everyone see my screen clearly? Am I audible? You can obviously just mention it in the comments. And while we do that, great, I've got a yes, so I'm just going to go forward. My name is Isaac. I'm from Team Ivory, and we are here today to spend 1 hour with you addressing questions about better brain health. And before that, a little bit about Ivory. Some of you actually have been associated with us for more than a year, even. Some of you have associated with us since the Brain Boost January activity started. But our main reason why we started Ivory is because when you look at the health ecosystem in India, you will realize that so much information is available for 20 to 40 or 45-year-olds. But when it comes to, high quality information about things like brain health and how do you age actively, there was very, very little, resources that were available. That's when my co-founder and I, Rahul and I, came together to form this. Alongside this journey, we were fortunate that we met a clinical advisor, Ms. Jwala Narayanan, who has joined us today. She's a neuropsychologist with over 12 years of experience and has got immense experience in working with patients who are either on the brink of or working with dementia patients directly. So she very kindly accepted our invitation to be a part of the clinical team and lead its clinical framework. So not only we are going to be all about sharing, building awareness about content, but also about building a clinical framework that helps people take better care of their brain health. So with that, I welcome you all. And Ms. Jwala Narayanan, if you can hear us, over to you for a very short introduction, and then we can head on to the questions.
Thank you very much, Isaac, for that introduction. And thank you all for joining today. It's very exciting to be here. I'm usually in the hospital, in my room, seeing people with dementia or people probably close to dementia. So this is really nice to be able to spend some time with healthy people and giving them suggestions on what might help prevent dementia. So I am a neuropsychologist and I work in 2 hospitals at Manipal Hospital and at the Anasami Hospital in Frasertown, Bangalore. And most of my work is in the area of dementia. I do see a lot of people post any neurological condition that is can be epilepsy, strokes, head injuries, infections. So we usually do an assessment to see how the brain is functioning. So like when you go through a scanner, an MRI, everyone's familiar with, it tells you the structure of the brain. So what we do is we try and understand how the brain is functioning. So we have some standard tools that we use that help us understand. And then we sort of make a diagnosis, and then we look into rehabilitation for people who have had a brain injury. So coming to dementia, we do a lot of assessment work in sort of trying to diagnose, to try and see if this is really dementia or if it's just sort of normal aging, or if it could be something else that's reversible. So we'll be talking a lot more about that shortly. And before we start off, I just want to clarify that today's question and answers is primarily on brain health, which is a little different from mental health. So I think there's been a lot about mental health now, especially post the COVID pandemic. So when we speak about mental health, it's primarily about your emotional and behavioral health, if you like. Whereas when we talk about brain health, it's more sort of, it encompasses our cognitive abilities, that's our thinking processes, things like memory, judgment, also our motor abilities. Of course, emotions also sort of come in that, but it's more from a brain function, whereas mental health relates more to certain neurotransmitters and the chemical activity in the brain. Okay, so today we'll focus on brain health. So Isaac, do you want to start off with your questions?
Yeah, we've got a bunch of questions. It was very encouraging to see so many of you. In fact, the very session we are doing, because, a lot of you approached us with questions and, we wanted to be helpful in some way. So with that, let me just go to the first question that we have, Jwala, which is that a 72-year-old gentleman on our group has asked, I am 72. How can I confirm that my brain is in normal condition? That's our first question.
It's a very interesting question, and I think a very relevant question, because I think when people come in, firstly, they always feel like, okay, I'm 60 years old, I'm old now, or I'm 70, I'm very old. And I keep telling people that, I see people close to 100. So 70 is definitely not old. I would say it's the new mid-age. But I think the deeper question about how do you confirm if your brain is normal, I think if you look at our brain sort of controls everything that we do. So if there's anything that is not functioning quite well for you, then I would say you need to get that tested, or you need to see what's going on. That might not necessarily relate to your health, your age per se. So don't worry so much about how old you are. I would just say that if something's not working too well, that is, if you're having mobility issues, if you're having emotional issues, if you're not sleeping well, if you've got vascular risk factors, if you have a lot of hypertension or diabetes, everything is basically affects the brain. So you need to make sure your general fitness, your general wellness is good. So anywhere you feel that something is not okay, I would say you should get it checked, and it might not relate to your age. So if at 72 you're functioning well, you're having no difficulties with your sleep, you're exercising well, cognitively, no one's complaining that you're forgetting things. Emotionally, no one's saying you're getting too irritable, you're not losing language abilities. I think that would say that you're doing well. Okay.
Got it. And yeah, we will continue to, take these questions as we go along. So some of them, could be related. So if your question is not here, I urge you to actually wait till the end of the session. Jwala is covering a whole host of topics which will address some of those, common questions as well. So here's the second question. It's a pretty, neat segue into, this one, which is, what is the best way to retain memory as I age? And why is my memory weakening? I would say this is part A, part B of probably the same thing.
So I'll probably start with part B. So, I find a lot of people coming in sometimes even in their 40s, 50s saying, my memory is just not like how it used to be. And this is where they're comparing their memory to like when they were 15 or 16, when they were studying in school, and says, I used to score so well. I had a photographic memory and I just can't remember things. So I think one is, as we get older, we are doing a lot more. So we do tend to take on a lot more responsibilities. As you grow up, you're working, you're multitasking a lot more. And I think that is really the key. We are doing a lot more than we used to do when we were much younger. And as that happens, the brain function sort of reduces a bit, because it's sort of diverting its energy and its attention to different tasks. So that automatically sort of reduces our memory. So sometimes it might not be that your memory is sort of going down. It might just be that you're allocating energy to other things, and it's not the same as having a completely free mind when you're young, and the only thing that you need to think about is going outside and playing. So that's quite different from when you're in your mid-40s. You've probably got a job, you've got job-related stress, you have kids, you have loans, you have probably elderly parents that you're looking after. So there's a lot more multitasking that's happening, and that's one of the reasons why people probably feel that memory is weakening. And of course, as part of the aging process as well, memory can sort of fade a little bit, but not necessarily always and for everyone. And I'm sure most of us can relate to this. If you sort of, look up at your parents, sometimes they have better memory than us. And so that's why I always tell people that it's not necessary that with age your memory will go down, but sometimes that can be part of the normal aging process as well. So just to give yourself some space to make errors if you are getting older, and don't compare your memory to when it was 20 years ago. And how do you retain memory? I think, it's really very important to think of memory as something that's quite fragile. So it can be affected by many things. So if your mood is not okay, if you're sad, if you're anxious, that can affect your memory. If you're not sleeping well, that can affect your memory. If you're multitasking too much, if you're extremely stressed, that can affect memory. If you've substances that you're on, like if you've taken too much alcohol, those things can also affect memory. So I think as you age, memory is really very closely related to overall physical health. So if you need to make sure that you're physically healthy, you're exercising well, you're sleeping well, you're also keeping your brain busy and active without stressing it out too much. So I think if you do all this, your memory will retain as you age.
Thank you for that, Jwala. Somebody was also asking if, this is being recorded. So if you have got friends and family, we will be sending out a recording link post the session that you can share with them. The next question is, what precautions can I take to prevent dementia?
Yes, I think this is a really important question, and thank you very much for asking this. And I think as we do more research in dementia, we're now sort of realizing that a large part of dementia can actually be modified and we can prevent dementia. So once we get dementia, it's harder to reverse it. But if you are in your 40s, 50s, 60s, 70s, you can prevent dementia. It is really important to sort of look at dementia as something that is related to your lifestyle. So there are various factors we call as pillars that are really important for our health, and that's something that can modify and play out a dementia. So some of the things I've already mentioned, but I'm sort of going to go over it because I think we can't stress on it enough. So one of the most important things is sleep. So, it's really, really important that everyone's sleeping well. Especially, getting your 7 to 9 hours of sleep is quite important. Sleep is a natural healer, if you like, and it also has an effect on a lot of your other health factors like your hypertension, your sugar levels in the body. So it does tend to heal your body when you're sleeping. So it's really important to focus and make sure you get a good night's sleep. And this is every night, not just, saying, okay, I'll sleep well twice a week, and that's not enough. Yeah, sleep is really important. Then I would say nutrition, make sure you're eating healthy. And, I always find this so funny when people have little gardens or people have pets. They're so particular about what their pets will eat, about what goes into their plants. But we never think about what goes into our mouth or what goes into our stomach. We're just so happy to open a packet of chips or to, just gorge lots of sweets. So I feel being really very mindful about what we eat is so important, because what we eat is what we are, and that determines our physical health. So really cutting down on the sugars, on the fried food, eating foods with a lot of antioxidants, and just lots of fresh vegetables, fruits, and less processed food, basically. So I think nutrition is really very important, and make sure you also do your basic tests and think of things like your vitamin B12, which has a direct effect on your cognition, so that you know that nutritively you've got everything in there to prevent dementia. And then another very, very important pillar is physical exercise. So, we need to keep moving. And I think this sort of goes back to where we've evolved from. We used to be hunter-gatherers, where we're always moving, looking for food. And now we've all sort of in these societies where our work itself doesn't allow us to move. So it's extremely important for us to be physically active. So, we always try and tell people to make sure that every 20 minutes you're moving for something, if possible. So even if you're at your desk job, after 20 minutes, after half an hour, just go take a walk, come back and continue. And it's a good sort of practice to also give yourself a break. So we've done sleep, we've done nutrition, we've done exercise. And now another exercise is not just physical exercise, but it's also brain exercise. So I always tell people that it's very important to make sure that we're cognitively stimulated. So what we mean by that is to constantly challenge your brain to make sure that, you're not just doing routine. A routine is good, so don't get me wrong there. Having a routine is very good. But what you don't want to just keep doing things that are passive, that's not making your brain think. So that's why people always suggest things like puzzles or crosswords. So those are great. But if you want to challenge your brain even more, maybe learning a new instrument, learning a new language, learning any new skill would be great. And I think apart from learning something new, it should also be enjoyable. It should also be challenging for you. So that is what we call as cognitive stimulation. So to make sure that your brain is getting the exercise. I give an example of, the brain being like any other part of the body. So if I had to tie your one arm for 6 months, what would happen to it? So look at the brain as the same thing. And this happens most often after retirement. A lot of people after retirement, they're like, I've worked for so many years now, I don't need to work at all. And then we just see the cognitive abilities declining then on. So I feel if anyone here is close to their retirement age, you need to have a post-retirement plan. And it doesn't have to be stressful jobs. It could be things that you enjoy, hobbies that you wanted to take on. I think those are the things that you should focus on. And finally, I would say socializing. It's extremely important. We are social beings, and especially during the pandemic, we've noticed how important it is to socialize, to be connected to people. So, finding yourself in the company of friends, family is extremely important. And I feel it's as important as maintaining your sugar levels, as important as maintaining your blood pressure. So being connected to people is really important. Doing cognitive games is very important. Doing your physical exercise is very important. Sleep, nutrition. So all of these have equal weightage, is what I would say.
Got it. Thank you. Very well-rounded, explained, Jwala. So lots to do. In fact, we will be spending a little more time on each of these individual ones as well as we go along. So do stay tuned. This is the next question. Before I get there, some of you have raised hands. You can type the question that you have on your mind in the chat box. We will keep kind of updating the questions as we go along in case they are not covered. So please do that. So Jwala, the next question is Alzheimer's hereditary? Can it be reversed?
So Alzheimer's can be hereditary, but not necessarily. So there's a small group of Alzheimer's that can be hereditary. But there's actually this famous nun study, which is a beautiful study that was done in the US, where they followed many nuns. And what they did was they found that a lot of them, even though they had the gene, that's the ApoE gene that we find in Alzheimer's, they didn't actually manifest symptoms of Alzheimer's. So I think that's a very promising, that it's not always necessary that if someone had it in your family that you are going to get it. Just focus on the lifestyle factors that we just discussed before this, and you will be fine, and you don't have to get dementia just because someone in the family has it. And can it be reversed? Very unlikely. So, there is a lot of research going in, and I think there are some drugs, but as of now, there is no medication that can completely reverse a dementia. It can slow the progress down to some extent if it's in the early stages, but I don't think we can reverse it as yet. But there are a lot of what sometimes people might get confused with, some things that are called as reversible dementia, which is, sometimes you can have symptoms that look like a dementia, but which is caused by, maybe like a depression or maybe a vitamin B12 deficiency. And then once that is treated, then you get a little better. So that is reversible, but that's not really then a dementia, and it's not Alzheimer's. So I hope that's clear for everyone.
Yep. Thank you for that. We'll move on to the next question. This is again linked to increasing forgetfulness. The question is, I'm having mental unrest and increasing forgetfulness. What's the signs, or am I moving towards dementia?
Yeah, that's a very good question again. And I think a very important and relevant one, because a lot of people, as they age, they do get a little forgetful, and then everyone's quite worried that they're probably getting dementia. So as I mentioned earlier, that there can be many reasons for why you're being forgetful. So just because you're forgetful, it doesn't mean you're getting dementia. I think there is a lot of other reasons that you need to rule out if you are being forgetful. Like I said, just make sure things like your mood, sleep, you're not multitasking too much, you're not stressed. And I think if those are okay and you're still facing forgetfulness, I think one of the biggest things that we don't give enough credit for is that sometimes we're not paying attention. So, we're not in fully present, we're not in the moment, and that's why we forget. So I think also making sure that you are in the moment, you are in the present. And especially this question, where this person is asked us saying that I have mental unrest and increasing forgetfulness. So I would say that it might be related to the mental unrest. So, maybe looking into what is that mental unrest, and then sort of thinking about a more medical condition would be my answer.
Got it. There is one question around, that is coming on chat. I'll take that specifically. But, you mentioned nutrition just a little ago, Jwala. So are there any specific foods to keep your memory healthy? And I think you briefly mentioned antioxidants. It'll be good to give our audience here some tips on what are some specific foods that keep the memory healthy.
Yeah, I mean, I think, definitely, firstly, reducing sugars because it makes you very sloppy. So reducing sugars and reducing fried food will help. And in terms of antioxidants, in the sort of Indian foods, like, they always say blueberries, but blueberries is not really natural to us. So, for us, we have things like amla, drumsticks, or turmeric in our food. They found that that's very helpful. And basically what research has shown is that a Mediterranean diet, which is basically fresh fruits, fresh vegetables as much as possible, lots of sprouts, beans, those are like superfoods that are good for the brain. Nuts, those are foods that I would say is good for the brain.
Got it. I'm just taking one. I noticed there are some very specific diagnostic questions that are coming to us on chat. As we mentioned, as you would have seen, we are taking certain questions that help maximum number of people. Unfortunately, we are not in a position today to address some specific diagnostic questions. So, please allow us that flexibility for today. As we build our clinical practice, of course, we'll get in touch and get to more specific cases. One question on chat, Jwala, that I'll just read out as is yoga helpful to keep Alzheimer's at bay? The second part is, what do you do when one prefers to remain alone?
Yeah, I think yoga. So there's no direct sort of research that's hard proving saying that yoga is definitely going to keep dementia at bay, but definitely I think a lot of the principles of yoga and what we do in yoga. So if you look at it from a layman perspective, yoga is giving you body physical exercise, and it's doing a lot of mind training. You're just there in the moment, in the present. So which automatically is what we now practice a lot and suggest is mindfulness. So just being in the present. And that sort of helps your alertness. It helps your attention abilities. So I think it does a lot that is good to keep dementia, to prevent dementia. So then I would say, yes, it's one of the things I also suggest to a lot of people to start doing. People who like to keep to themselves, yeah, I think there are a lot of people who might just be innately introverted. And when I say socialize, I don't mean to say, okay, you need to put yourself in a family wedding every week so that you're, socially occupied and you'll keep dementia away. So if that's something that you don't enjoy, then it sort of beats the whole purpose of what we're trying to do. It should be enjoyable. But if you are someone who likes to be with yourself, what I would suggest and really urge you to do is at least get out, at least connect with a few people, because that whole connection gives a lot of cognitive stimulation. So just as simple as, when you're having a conversation with someone, you need to remember who they are. You need to remember what you spoke about last. You need to see where they are in life. You might strike a conversation about the news. So there's a lot of cognitive stimulation that's happening when you socialize. So I feel even if you are someone who is innately just a loner, a little bit of socializing is something that I would strongly suggest.
Got it. Got it. So one more question, because food is of course something we do on a daily basis, Jwala. The one more question is, recent research has been showing that gut microbiome can have a profound impact on the brain. We don't talk a lot about the microbiome in India. What kind of foods can help with this?
Yeah, I think this is not really my area of specialty, so I don't want to comment on it. But yes, there is a lot of information coming on gut microbiome. And I think we're still, so there's one study that's sort of being run in the UK at the moment, where again, they're following a whole population and they're looking at gut microbiome, but it's still sort of in the early stages. So I wouldn't comment, but it looks promising is all I can say.
Got it. So let's move on. Okay, so we've had some question and answers, and we will continue to do the question. But as you know, with Brain Boost January, we've been doing a bunch of brain teasers, puzzles, visual quizzes to just keep each of us stimulated mentally. So here is a question for everyone. I hope everyone can see this visual on the right-hand side of the page. The question is, can you spot the hidden number? Most of you are on mute so that we can clearly conduct the session, but please feel free to drop the answer if you know it. Even if you don't know it, we'll give you the answer, and we'll also tell you why we've included a question about game. But just a little break, maybe a 40-second to 1 minute break for people to cleanly look at this image and then see and then drop in their responses on chat. Have we started getting some responses? Okay, good. Yes, you can also say whether you are able to see the number or not, or you can put the exact number you're able to see. So absolutely fine either way. Some very different answers are coming across. Thank you, Meera ma'am, Rachna ma'am, Ashwini ma'am, Shalu ma'am. I think a bunch of you are now putting the responses. Ramachandra sir, Archana ma'am. Some people have also said that they can't see a number, so we'll give the solution to this shortly. Okay, I think everyone's had a fair shot at it. We'll continue with the session, but before we do, here is the explanation of the particular quiz that we had for you. A lot of you should actually be able to see 528. This is a category of visual illusion puzzles. Some people see 45284, but the actual numbers are 3452839. I know at least that the last response that came in was the right one. And this is essentially a sensitivity trick that sometimes visual puzzles can play. But this is just as a fun teaser and an icebreaker. Please don't read anything into it. In case you have not been able to get it, it doesn't mean anything. So, but before I move on, Jwala, what did you see? I saw 45283.
I saw all of them. I saw 3, 4, 5.
All of them. Yeah. So I did not see the whole thing. Okay, cool. So just moving on, let's carry on about healthy aging now. Now our questions are moving more towards what are some of the things that are within our control that we can do for healthy aging. And the first one is we just played a game. Jwala, I think our audience would like to know what kind of games can help us, and at a very high level, how can we slow down the aging process and keep the brain sharp?
Yeah. So, as I give you the example, the key is really to keep the brain active and to keep challenging it. So that's really important. And what tends to happen is once we get into our mundane life and our routine, including even if you're doing a job, it's pretty passive. And after a point, it becomes very automatic. So if you sort of try and find games or activities that are constantly challenging your brain, then you're keeping it exercised. So there are lots of games that you can play. I would always say if you can sort of do it socially, that's even better. So if you can sort of, I think some people have asked a question about playing bridge. So if you can play bridge, if you can be in a group and meet for playing cards or playing Scrabble, any other games, that's great. But I think something a little more challenging that you've not done before. So now we have a lot of apps that have these games. And in fact, I think even Ivory is sort of heading towards that space. And right now what Ivory is also doing on the WhatsApp groups of sending riddles and games, that's fantastic. And that's what I think more people should be engaging with as well. Apart from these general games and also, looking at the sort of puzzles that people play with, I think another thing that can really help is being a little more engrossed in I'm so sorry. I'm just sort of lost my train of thought. I wanted to say something and I lost that out. But yeah, so just sort of coming to a lot of the online games right now, we have very specific games that are for memory or for attention, and I think those are really helpful, especially the attention sort of related games, because once you sort of get into just increasing that attention span, then automatically your memory improves and your problem solving skills improve. So a lot of the times people ask me if I should play these brain games, and I always say that if you're doing nothing else, then the brain games are great. And if you can do a little more, then if something is a little more meaningful, so, when you are maybe learning a new activity or a new skill that you can see, you can get some feedback, then you do even better. And another thing that now they found with the games is they've sort of been making it gamify, like, I don't know if you're familiar with the word of gamification. So when you have these activities that you're doing, which is for the brain, and it's in a game form, we tend to get more attracted to it. And then we want to do more and more. And that is really good for the brain. And these games that they have online now also is sort of interplayed with AI. So they can get tougher and tougher for you. So you are actually challenging your brain more and more. So I would say definitely try the games that are online and wait for Ivory's games to come out as well. We're going to be helping put some games into Ivory based on the research work that we do with people with brain problems and what can help prevent dementia. So definitely look out for that space.
Yep. Thank you. Thank you for that. And just moving on, around games, I think, there is obviously a lot more that Ivory will continue to do. And just now, very quickly, moving on to the connection between hearing loss and stress and memory. Like, if you can spend a couple of minutes on, does hearing loss directly impact our brain, causing stress and memory?
Yeah. And again, thank you so much for asking this question. This is a really, really important question. We've seen a lot of direct sort of correlation with early hearing loss and dementia. And this is more in people who haven't used a hearing aid. So I think when people do have hearing loss or any actually sensory loss, so hearing or even vision, it's extremely important that you correct it. This works at different levels. One is when you don't correct it, then that part of the brain is getting less stimulated. The other is also you socially disengage. So because you have a hearing loss and you don't go out and meet people, or you're a little shy about, meeting people socially because you can't hear them, or you say, oh, I can't hear them anyway, so I'm not going to go. So it does sort of start to impact your brain health. And it also causes a lot of stress. And then eventually it can affect your memory and other cognitive abilities as well. So I would say, please do take your hearing loss seriously, vision-related issues seriously, and definitely do get help for it if you have a loss.
And Jwala, one more, I would say limbs and organs related question. The question is, finger shaking is brain related. What is the solution?
So it can be brain related. I mean, I guess it is brain related, but there is something called essential tremors that a lot of the times people get as they get older. Sometimes that is hereditary. And there's no, I mean, sometimes neurologists can put you on medication for it, but a lot of times they might just say, it's nothing to worry about. What I would suggest is to try a little bit more of, things like yoga that has sort of shown to help. And what you'll also notice is that the more conscious you are about it, the more anxious you are about it, it actually increases. So just at some level, trying to calm about it will help reducing it. And if it's really disabling, then I would definitely see a doctor and see if there's something that they can give you for it.
Got it. And I still see some raised hands. Please do type in your questions on chat. As you can see, we have started taking some live questions as well as they are coming along. So please continue to do that. The next question is, are both sides of the brain active parallelly, simultaneously? And what advantages come with increased left brain activity?
Yeah, so I think, there's a lot of myths, I think, about left and right brain and saying someone is more left brain or someone is more right brain. I mean, there might be something to it, but on a large, we're using our whole brain. You couldn't just live with one side of a brain. And our brain sort of needs both sides to work through it. I think one of the most, why there's so much importance given to the left brain is because most of our language area is in the left brain. So it sort of becomes the dominant side of the brain. And that's why we're right-handed, because that's everything on the left side of your brain controls your right. Everything on the right controls the left. So I would just say both sides are equally important. And, I don't think there's an advantage as such of being more right-brained or left-brained in that sense. Yeah.
Okay. The next question is how to maintain dopamine levels in the brain and what leads to its reduction. And perhaps, Jwala, you can maybe begin with like what dopamine is. Very specific question.
So dopamine is a neurotransmitter, and that's basically, it's like this chemical in the brain that makes us happy. It also sort of helps in things like memory. It helps in movement. So it has a lot of in relation to our emotions, mood, activity levels, and cognition. So sometimes it can go down, and it can go down due to many reasons. Again, the same reasons that I've mentioned right from the beginning. So it can be due to stress. If you have mood-related issues, you can have low dopamine levels. If you are not sleeping well enough, that can also cause low dopamine levels. So what you can do to sort of help, increase it or reduce the reduction is to, the natural one is exercise. Exercise is extremely good to increase your dopamine levels in the body. And just, again, leading a really healthy lifestyle will automatically raise that dopamine level. Doing things you like, sometimes listening to music you like, engaging with people you like, activities you like, that can automatically increase your dopamine levels. So I would say, anything that gives you some joy, and exercise is really important.
Got it. Moving on to the next one. And this is, I'm sure, very relevant to a lot of our audience, and where Ivory will also have a role to play. The question is, what are symptoms of dementia, and are there any tests in India for this?
Yeah, I think someone asked this in the chat now as well. So dementia is an umbrella term. So basically, it means a neurodegenerative condition. That means the brain is degenerating, it's progressively dying, or, the cells are dying, okay? The dementia and the symptoms are related to whichever part of the brain the dementia starts with. So it can be anything from memory to language. It can be your suddenly, people can become very disorganized. They can change in personality. They can have increased irritability. You can have mobility issues. So really depending on which part of the brain these problems are starting, and that's how we make a diagnosis as well. So it's sort of very specific to different areas of the brain. And then we sort of look at the profile that a person presents with, what kind of memory problems they're having, what kind of movement problems they're having, and then that helps us give a diagnosis of dementia. Okay, so basically anything from movement to cognitive abilities, that's your thinking processes, memory, your emotions, and your behavior. So you can have any of these symptoms in the early stages of dementia. And as it progresses, they all sort of start to worsen. So someone might start off with an Alzheimer's, but they might also later have movement-related problems. So because the whole brain is sort of degenerating. Yeah. And are there any tests in India? Yes, we do have. There's no one test for dementia as yet. So that's why when someone goes to a doctor, they make you do a whole host of tests, many tests. So you have blood tests. They might get you to do an MRI. We do a lot of cognitive tests. So that's what I do. We do have some tests that we've adapted for in India. In fact, I was part of this big ICMR project where we've sort of adapted it and use it in 5 cities across India. And now with Ivory, we're also sort of developing some tests that we can use specifically for our Indian population. So I'm really excited about that because that's going to be on the phone and through an app. So that's going to be very exciting.
Thank you. I'll just take one question from chat, Jwala, and please feel free to direct it in case this is not exactly brain health related, but still, can you please touch upon how to manage adult ADHD and procrastination?
So I think I could do a whole day's talk on adult ADHD. So I'm not going to go into too much detail about that. But I feel, one is the diagnosis of adult ADHD itself is quite gray. And it is very individualistic. So you would need to get a proper diagnosis first. And in terms of treatment, there are some medications that might help. But in the long run, what really helps is making those lifestyle changes and using strategies to overcome problems that you might have in your everyday life. A lot of people who've had undiagnosed ADHD are very successful people. They've gone on to do a lot in their life and they've found their own ways to sort of circumvent these problems. So it's not something that's impossible, but you might, there's a lot of literature online these days. If not, you can find a therapist who will help you work through some of these problems you have.
Got it. So we will just move on to the next question. I think you had briefly touched upon it in the ways in which we can prevent dementia, but if you can sort of go deeper into how is learning new skills and brain health related?
Yeah, so I think it's really relating back to the body. It's just like building a new muscle. The brain is what you expose it to. So the more you expose your brain to different things, the more you're opening it up and you're exposing it to different experiences and it's learning from it and it's just getting very enriched. If you compare, if you sort of had to just look at a person being locked in a room, getting no stimulation from anything, so the brain will just get retarded. So the more you do, it's just getting more exposure, and that learning sort of increases the connections, the connectivity levels in the brain. And that's what helps in the brain health.
Yeah. Got it. So just moving on, and I think this is again moving more towards the things that are within our control, Jwala. So we can spend some time on how can we maintain a calm and stress-free brain. Some people have also asked things like, there is a lot of information overload out there, too much things, everything is getting dissected. So within this, overload information age, what are some tips that, will help us maintain a calm and stress-free brain?
Yeah, I think this is, again, a very, very important part of sort of managing or preventing dementia is just managing stress. and how to stay calm. I think there's a lot now on mindfulness, on being present, being in the moment. So I think one thing is, just changing the way we look at stress. And a lot of it is the way we believe. So when we are stressed about things, a lot of it comes from our beliefs. Like, we have to have things a certain way. And if it's not a certain way, then that's uncomfortable for us, or that leads to stress for us. So sometimes just thinking differently about it, do you really need it that way? Does it have to be that way? That itself, if you can just start questioning, start thinking on those lines, that will start making a change in how you react to things or how you manage stress. But on a general note, I would say, there is just too much going on everywhere. So if you can just spend some time with yourself every day, turn off from everything, be very mindful about what you want to do in your life, what you want to do for the day. I always tell people it would be nice if you could just get up in the morning, spend some time with yourself, even if it's just 5 minutes, and just do some mindful breathing, and then just set the tone for the day. What is it that you want to do? Be very clear on that, and that will help you calm down. So I think just a little bit of on sort of yoga, mindfulness, regular exercise. I think these are things that really help with the stress. And then the most important thing is thinking differently. So your mindset does need to change when it comes to managing stress. Yeah.
Got it. Okay, just moving on. There is a question before I go there on sleeping pills. We believe, I think we're taking this because some of you already might be taking sleeping pills. The question is, I'm taking sleeping tablets, does it harm the brain?
Yes and no. So I think, when you do take sleeping pills for an extended period of time, it can harm the brain. But at the same time, if you're not able to sleep without that sleeping pill, then that's going to do more harm to your brain. So it's really balancing out. So there are, I feel if, you are someone who's not really tried enough in terms of sleeping on your own, in terms of, all the sleep hygiene that we sort of follow, trying to set a routine sleep pattern, making sure you have a warm bath in the night before you go to sleep, drinking maybe a warm glass of milk, doing some physical exercise, maybe at least an hour or two before you get into bed. So if you sort of can't sleep with the regular sleep patterns, the sleep hygiene, then I think, having a pill is something that you might need to do because you have to sleep well. So I think we have to balance it out. All medications can have some side effects, but you need to see what the condition is first. So I would say go back to your doctor if you're on a sleeping pill, and maybe try it out, try and see if you can get on a smaller dose and get some sleep, or try some other ways, non-sort of pharmaceutical ways of getting to sleep. And if you can't, then I think it's absolutely fine to use a sleeping pill. Yeah.
Got it. We've got 10 more minutes to go, so I will try and cover everything that has gotten maximum coverage of people asking us. We'll just move there and then keep looking at the questions in the chat window. So this is a very specific question. We've spoken about dementia, Alzheimer's even. This gentleman, this participant actually has this question. My 80-year-old father had a brain stroke in spite of a healthy lifestyle. What are the causes, precautions, and chances of strokes in old age? So an extremely important question for a lot of us.
Yeah. So I think, it's once you sort of hit 80, actually, it's just a number, but still 80 plus, the chances of getting a stroke are higher. It's just that the blood vessels in the brain are sort of getting weaker, we're aging, but also what can be a big modifying factor is your vascular risk factors here. So things like diabetes, hypertension, you have to make sure it's maintained well. And if you can, that brings down the possibilities of having strokes. Another really big modifying factor is smoking. So if we are smokers, especially even when you're young, if you can stop it right then, it's a complete no-no. So if we can completely get rid of smoking, I think we'd all have much healthier lives. But yeah, it's never too late to stop smoking either. Just because you're in your 70s and you're like, oh, I should have stopped when I was younger. It's never too late. So I think things like managing your vascular risk factors, including smoking, is really important. Also, alcohol plays a really big role. So too much alcohol, and not just too much, actually, it's different for each person. Each body type is different. So really looking into when you're having the alcohol, what is it? Are you using it as a coping mechanism? And then that becomes unhealthy. So also sort of managing alcohol levels can help with just reducing the effects of all this as you get older. Yeah.
Got it. Yeah, one more question. This is actually one of our last questions on the slides, and then we'll go back to some of the questions on chat. So my 97-year-old father, previously healthy, now has dementia and exhibits aggressive behavior. How can I help him fight forgiveness and make him calm?
Yeah.
Find forgiveness.
Yeah, I think, what I tend to tell families is try not to read in too much into a person who has dementia, because it's a very disordered mind. And I think also it's one way I understand it is I feel it's like this puzzle that you're constantly trying to put together. So, the whole behavior is very disorganized. They're not able to sort of understand what is going on with themselves, and they're not able to express what they want clearly. So then it might come out in aggression, or it might come out in abuses or curses, but it does not mean, they're doing it intentionally to say something to someone. Or sometimes someone might say, oh, maybe this is something they've always had in their mind and they're getting it out now. And that, I don't think that's true. I don't think we know enough, and it's not fair to sort of put that on someone, who has dementia, who can't really fight for themselves at that point. So what I would say is, when you have someone with very aggressive, agitated behavior with dementia, try and change the environment. So one thing that people with dementia as well can see is they can sense anxiety, they can sense frustration, they can sense anger. So if you are frustrated, or at home, if we are frustrated at being caregivers, they sense that, and that can then increase the aggression also. So I feel maybe just looking out for things like what in the environment is causing that aggression. So just being really observant. Sometimes it might just be, a certain material that they're irritated with, or it can be a certain sound, or it can be certain people that, bring in a perfume that they're irritated with and they don't like. So just being really observant about the behavior and seeing when that behavior occurs, then you might be able to modify it. So I think the key here is really understanding the behavior and trying to see if you can modify the environment, because you might not be able to change them. And the other thing is to engage them. So a lot of the times, because they're not able to organize their own behavior, their restlessness, their boredom leads to a lot of aggression or behaviors that's inappropriate. But what we notice is that the moment we get them into regular activity, they're engaged and that behavior goes off. So just trying to engage them might also help.
Got it. So we've reached, the end of questions on the slides, but I still have some questions to go on chat. Jwala, incidentally, a lot of our audience today is actually women. And there is a question on, menopause and the relationship between brain health at a very high level. If you can just touch upon that, that would be helpful as well. Is menopause a contributor towards brain health?
Yeah, so I don't think it causes dementia. I think that was one of the questions as well. You can have cognitive difficulties, perimenopausal or even postmenopausal sometimes. There is research is still sort of coming out in terms of what is really going on, but the estrogen definitely plays a role in our cognitive abilities. But the good news is it's something that can get better. So you might have that, few years or a few months of brain fog, but it will get better. And I think just following the other sort of general health principles will help improve your cognitive abilities. So maybe just reducing multitasking at that time, doing maybe more yoga, being more mindful, eating healthy, exercising. So doing all the general sort of health precautions would probably help relieve those symptoms as well.
Got it. One question around, migraine, that I'm having frequent, migraine attacks. Due to your problem, I have migraine vertigo problem. Does this affect the brain?
So I think whether it has sort of a direct impact is something I'm not quite sure actually. But the way I see it affecting is if this is something that's causing you a lot of stress regularly and you're in constant pain, or you're, because of the vertigo, you're just feeling very confused, dizzy all the time, then that can affect your general health, which can then affect the way you're feeling and the way you're performing and your memory and other things. So I think with direct sort of correlation with migraines and memory, I'm not so sure. But yes, definitely the pain itself can affect your cognitive abilities. And sometimes, with migraines, you can have things like hallucinations, you can see things, you can see colors, you can see numbers. So there is, some aspect of the brain that's sort of, showing out more symptoms. But yeah, it doesn't have to be bad in that sense. So it's not affecting your brain healthfully, but you should get treated because the pain can be quite severe for a lot.
Yeah. One more question on good B12 and antioxidants to maintain brain health. I think that's a pretty important part. If you could just repeat that part once again, I think it will help a lot of people.
So B12 is usually found in fish. So if you're vegetarian, then there are B12 supplements which are available, and you should probably see your doctor for that and get those prescribed. Apart from, I think lots of green vegetables as well has B12, but their concentration is much lower than compared to fish. So, but yeah, fresh vegetables, fruits would definitely be something that you can go to, and fish.
Got it. We're nearing the end of our time, but there is one last question which is linked to sleep. You've already touched upon this. Is insomnia related to dementia and Alzheimer's? We'll close the session after this, but Jwala, over to you for the last one.
It can be a risk factor. So, dementia has many risk factors. So if someone's had, prolonged sleep issues, insomnia, or even sleep apnea. So sleep apnea, we know that is treatable now, and you should treat it because that reduces your sleep cycle. It reduces the oxygen going into your brain. So I would say, yes, it is a risk factor. It might not cause it, but it can trigger it. It can definitely lead to dementia. But again, it's not something that will cause dementia by its own. So it's a combination of things.
Got it. Thank you so much, Jwala. We were very much like, we didn't give you even a second's break from the time you came in for addressing all these questions with so much patience. And, you also repeated, everything that was required. So thank you once again. For everyone else who has attended, we hope you found this session useful. We'll be shortly sending a questionnaire about, any feedback or any question that you would like to address. We always, we are here to actually help people who are going through something that they can't talk about or is not relatable enough with other people. So please don't hesitate to, use the form to share any other questions that, you might have your way. We will organize more such sessions. And of course, all of you are already part of the WhatsApp group. So do continue to, participate there and watch out for new updates that Ivory, the app, and the clinical framework that we'll be coming up with shortly in a couple of weeks. Thank you once again so much, everyone. Have a lovely evening. Please stay active and stay sharp. Sleep well. Eat well. Thank you.
Thank you. See you.
All right.